and he will talk about he will questioning about harm reduction access for migrants.
Hello, thank you. I'm the last in this session, so I have to lift you up a little. You seem tired after eating and all of this. And it's so great for me to be here, because we're in the center of Europe, and the drug users are so tolerated, and the police are so tolerable that they are, just working with how people behave instead of criminalizing. And I come from Norway, Oslo, Norway in the north, and we're quite close to Russia. We're very close to Sweden. And we don't have many harm reduction measures. We have quite a few, but still there's mostly repression. And repression, that is oppression. And you can get, sometimes it feels like the open drug scene started because it was tolerable. But this started with the prohibition and with the intolerance against drug users. That's why we have had these open drug scenes. And when we just used the police, we had still had open drug scenes, and we have that in Oslo, and we have that in the second largest city in Norway, Bergen. And the police is there all the time, handing out fees, arresting. I mean, this is just discrimination, and this is so bad that they should fight much harder against it, because this is counterproductive. And we have done this against minorities so many times, and we should know better now. Zero tolerance is a politically correct word for something so politically incorrect as non-intolerance. And that is not good enough. So, what happened? We got the HIV problem that was bigger, seen as a larger problem than the drug problems. And then we in Norway looked down to other countries, and we saw that there was more HIV among those men who had sex with men, and those who used injections with the drugs. So maybe we should do like in Central Europe, hand out some condoms to men who have sex with men. Okay, we can try out that a little. And it worked, then we continue. And then we said, maybe we should hand out needles to syringes to drug users. What? Are you going to hand out screwdrivers to burglars and child to pedophiles? Because people look at drug use as being a criminal. But we tried non-governmental organizations. We were having debates for 5 years, and these tryouts with the little buses and so on. And now we're handing out 6,700 syringes in Oslo every day, 2.1 million in the year. In Bergen, 520,000 a year in 2011. In 2012, 630,000. And we have a sort of consumption room since 2005. They say it's a drug consumption room, but it's so narrowed because all the harm reduction efforts, they are very hard to implement because the overall policy is to harm, and drug users were seen as enemies of the society. So we should just harm them, we should just punish them. So it's so hard to start helping them also. It's contradictory. But so our injection site, most of the years, has been open for 6 hours a day, and you can only inject heroin. And our new health minister just said, if we open up for all to smoke heroin there also, then there's just a free spot. People can have cozy and use as much drugs as they want. So we have the evidence on our side, but that doesn't help because the prohibition ideology is standing in our way. But after we have, in the media, when you look in the media now, you don't see the police. When the police see cameras, they just run away. So I'm very often down there with the open drug scene, with the media, and the police goes away. So when you go to conferences, and when you look in the media, it's about including drug users. And they must have a place to live. They must get money. They must get medication. we must hand out harm reduction tools. So they are being more and more tolerated in the society. And that leads to the question, what about migrants? Now there are coming a lot of new groups, people from south of Europe wanting work, staying legally and illegally, many people from Africa trying legal and not legal, asylum seekers, migrants, and Rome people, and I have to mention the Roma people because that's a big problem in Europe. And often when I meet people in the harm reduction area, we are talking about human rights and inclusion and the welfare and the dignity of people. But when it comes to Rome people, very many people fall off, but they are humans and they are as much worth as anyone else. So now we see in Norway, now it comes to other skin colors, other religions, other minorities. And I think that's this is very hard to keep up the tolerance, because now it's not so very popular longer to have new places to help those groups. So now it's non-governmental organizations that it's tolerated that they let 50, 60, 70 have a place to sleep. It's tolerated that some of the low threshold places where drug users can go, some of the opening hours, some of the migrants can come in and get something to eat. They can go to the heroin injection site and they can go and get syringes. But as I told later, you can only get the syringes because if you also hand out steering ducts and filters and also prevent hepatitis C, that's going too far in the direction of legalizing, they think. So all the harm reduction measures are so narrow because of the prohibition thinking. And Norway is a long country. We almost only have these harm reduction measures in the big cities, and it's a very big challenge that in the cities it's more and more intolerance because there are new minorities in that group. And therefore, we will see more harm, more drug-related deaths, and more disease, viruses among those people that we have to start to agree that we have to give any kind of help to any kind of person, wherever that person is, and we don't care why he's there, right? We don't care where they come from. Everyone should have access to health care and harm reduction services. That's from the drug users. Thank you.